Hey, hey, hey. Oh, you got on, Denisha. Thank you.
Yes.
Hey, Sierra.
Hello, hello, everybody.
Hello. So, I'm going to have, when you're not speaking, put your speaker on because there will be feedback if you don't.
Mute our mics. Is that what you're asking?
Mute. I mean, mute. I'm sorry. Yes, it's when you're not speaking. Hey, Alice. How are you? Hey, ATL Shawty. So, Brandy, put your speaker.
I'm trying to get on YouTube. As soon as I get that situated, I will mute myself.
When you come in, please hit the thumbs up button. If you're not subscribed, please subscribe. Okay, if you're in the chat, can you please tell me if you're hearing feedback? Because there is a hmm.
You have feedback on your end?
Mhm.
Hmm.
Hey, Janice. Okay, so I found the problem. Thank you for joining us. So I'm gonna let everybody introduce themselves and remember to when you're not speaking to put your mute or your mic on mute. And if y'all gotta remind me, remind me. Okay, we'll start with Denisha. So today's topic, just so you know, today's topic is there's no shame in mental health therapy. Healing only begins when we come out of hiding. All right. So introduce yourself. Then we'll start with Denisha and then um, Sierra.
Hi, I am Denisha Reed, and I have been working in the mental health field for the past 12 years.
I am Sierra Miller, and I've been working in the mental health field. Ooh, how many years has it been? I want to say, I'm gonna have to calculate that. I don't know if that starts. I would say at least the last 5 years, 5 or 6, in different settings, juvenile home, foster care setting, school setting, daycare setting. I guess I wasn't mental health in the daycare setting, so no. But yes, that is me. I am a single woman, no children. It's just Sierra.
And you said foster care?
Yes. Yep.
Brandy.
I'm in community mental health.
My name is Brandy. I am not a mental health professional. I am a family life educator and a certified Christian life coach.
Before we get started, I'm just going to put this comment up here. So ATL Shawty says she has a daughter now that's suffering from mental health. She has some mental health concerns or struggles. She was in, oh, so ATL Shawty, do you want to say more? Like, how is she doing now? So, yeah, Brenda, do you want to start? And I'll keep an eye on the chat. Oh, Janice says her cousin works for the VA as a counselor and a mental health professional.
I see that. I would love to hear about that experience. I work at the VA as well in HR, but we definitely get our fair share of instances where we're dealing with people who are struggling with mental health. Sometimes a simple process is getting hired and onboarding, or being told that you're not going to be hired. People start to display some symptoms, and sometimes you do have to talk people off a ledge. And even though my position isn't directly in mental health, we still have to take those trainings as far as veteran suicide and things of that nature. So it's all very closely connected. So our first question to you ladies and the chat is, what does mental health mean to you personally? Who would like to go first?
That I'm trying to think of how to really explain it. But it's just like, what does it mean, or how do I explain? Or kind of both?
Both. I think whatever comes to mind.
So for me, it just means taking care of your mental. The same way that we take care of our physical bodies, it's even more important to take care of your mental health, because that's where, our brains control our bodies. So if our brains aren't healthy, then our bodies in turn can't be healthy as well. So for me, it really just means taking care of your mental, taking care of your soul, taking care of your spirit, and then the physical and things follow after that. So that's what it means to me, is really just, like I said, taking care of your inner self.
And for me, I have a lot of customers. We call our patients customers where I work at our CMH. It's just really somebody dealing with past life traumas. Some have chemical imbalances in their brain, and then it kind of messes with their emotional, social, and psychological functioning. So a lot of people ask that question, like, why do I have a mental health disease or disorder or diagnosis? And that's typically the examples that I will provide to them. That is just some underlying past trauma that you may have. And so we have to work with that. Or it could be like a chemical imbalance where you may have to take the medications for, because that would be the only thing that may work for you.
I like that you mentioned the part about chemical imbalance, because me working in the school system, a lot of parents want to shy away from medications and, the label, and allowing their children to receive medication because they don't want them to be dependent, or, just the stigma around medications. And I've had to explain it to them that way as well, as it's a chemical imbalance. So this is not, it's not just because little Timmy is bad. No, there's something in his brain or body that he is missing, and that this medication has, and that he needs it. So, you have to you should give your child what they need, whether or not but I do understand the stigma around it. But I like that you mentioned that, because I've had to explain it to them as, as a chemical imbalance. Like, it's a physical, scientific thing. Like, it's not just he doesn't want to do what you're asking him to do. So
those are both really great. Was there a particular experience that shaped your perspective, whether it was positive or negative?
For me, just past life traumas for myself, or dealing with other family members that's dealing with different mental health diagnoses and trying to help them through it. And then just really working in the field for over 12 years, because I started off doing maternal mental health. So really working with mothers who were suffering from postpartum diagnosis, and helping them through that, and trying to still inform them like they matter, like being very empathetic to them. And then working in adult mental health now, that can be a tough field. And people, like Sierra said, they don't like to be labeled, and it's a scary thing. And I'm like, it's just a label, it's a name, it does not define you, it does not define your character.
So real quick. Oh, go ahead, Sierra.
Nope.
Go ahead.
Oh, so when you asked, was there like a particular moment? So I guess I'll talk about what kind of made me want to be a mental health professional. Just growing up, I had, so there's two things I always talk about. The book, A Child Called It, that series, that just kind of introduced, like, it literally broke my heart. And I felt like I had a responsibility to help children in the future. That's why I went into foster care thinking, but I realized that I can help in other ways. That's not my area. So that book. And then also I had a friend in my class growing up in 4th grade, and she would come tell me about all of the things that was happening in her home, and I wanted to help and be there for her, and it really broke my heart, and I really wanted to do something about it, but I'm in 4th grade as well. I can't do anything about it. So that, and then coupled with my mom being in the mental health, those three things together kind of started my wanting to be a mental health professional. And I kind of, like I said, had that in my mind as a young girl, and I just went for it.
So if I could I want to read ATL's comment, and then if we could just, I would like to know your thoughts on this, because I think a lot of people don't understand mental health because it's not something you can see for the most part. A physical ailment, we talked about this last week, a physical, someone, breaks their bone, or someone has cancer, right? Someone has leukemia. That's something you can see. So ATL says, I wish my family and friends understood what mental health really is for my daughter. So what are your thoughts on that?
So a lot of family members, that's something that we're currently dealing with, and I typically try to assist families with that. I'm currently in the process of coming up with something that will allow families to understand better. There is a group, and it's in Michigan though. So unfortunately, if you're in Atlanta, it's called NAMIS. It's a National Alliance on Mental Illness, and a lot of families attend that so they can get a better understanding on it, because you do have families that come in and they don't understand it, or they're dealing with their own mental illness, or they're saying, like, if somebody's suicidal, they don't believe them and things like that, or they can stop it, or if they're depressed, or they can just stop it. They don't have to do that. It's easy. I got through it, but everybody is not the same. So you do have that where families definitely need to be educated. And if they don't go through that education, then they won't have the understanding that they need. And it will cause you to be depressed even more. Or like somebody said, their daughter was dealing with that and they hope that their family could help with that. It's just really that they need to get educated on it, because if you're not educated on your mental health, then you're not going to be any help to the person. You can be detrimental to them.
So what was that resource again?
It's called NAMI. It is a National Alliance on Mental Illness, and it's a lady that runs that. You can look it up. You can Google it, but she runs that in a lot of Calhoun County areas, but I know she's from Michigan, and she does travel different places, but I don't believe outside of Michigan. But I'm sure that if you reach out to her, she will be able to connect you with resources in the area that you reside in.
Okay. Did you hear that, ATL? And that's the acronym of NAMI, right? Because I use them a lot of times for when I'm looking up different resources.
Correct.
So ATL, you can Google NAMI, NAMI, Denisha. What does it stand for again? The National Alliance of Mental Health Illness?
Correct.
Yep. So Google that and see what resources you can find. And, you know, if not for yourself, then for your family. Okay, go ahead, Brandy. I'm sorry.
Oh, no, you're fine. So we've talked about people not wanting to be labeled, but are there some other common misconceptions about mental health that you all would like to address or just kind of share?
I think on the flip side of not wanting to be labeled, there are also some people who give labels to themselves or others that like overly label. Just because you get angry quickly does not mean you're bipolar. Just because you like to sleep with a certain pillow doesn't mean you have autism. Like, it's just like little things where people will take maybe one symptom and diagnose themselves or diagnose other people like she's, you know, schizophrenic or something, or using it as a derogatory term rather than a medical term of, you know, what it is. And 9 times out of 10, she does not have that. You just labeled her that.
Yeah, I just did a training on Thursday for the support staff at the college I work for. And it was on mental health stigmas. But I talked a lot about language. It's important to, what's the word? Not trivialize, right? What people are going through. So, because they can hear you, right? And I know you all have heard, oh, the weather is so bipolar. Come on. It is not. It changes a lot. Yes. But it's not bipolar. Right? So we have to be careful about how we say things and what we say. Calling people crazy.
We talked about that on our first live, about how collectively we could do better to change kind of that narrative and that language and start or stop using those for, like you said, the weather's bipolar, or referring to a person as, oh, that's just such and such, they're crazy.
Right. We got to be mindful of our language. Denisha, you were getting ready to say something.
I was. And it's just being mindful of who you're around too, because you can cause secondary trauma as well when you are speaking on different things that somebody may have went through. It's the one thing that people have a misconception of, though, that kind of sometimes you have to correct things too when people don't really have the knowledge of mental illnesses. So people say, like, if they don't like to talk to people, that they're antisocial. And I'm like, that's not what antisocial means. Antisocial is a person that is pretty much, criminals are labeled antisocials because they have criminal behaviors, they have no regard for the laws and things like that. A person that is social distance from somebody and has social anxiety is actually called schizoid personality disorder. It's not schizophrenia, but it's called schizoid personality disorder. So a lot of people have that misconception when they're saying, I'm antisocial, and it's like, no, you're really not, unless you're, labeling yourself almost like a criminal. So that's just one misconception that I hear a lot, that people label themselves that, and they're just not educated to know the correct terms.
That was a really good one.
I do have another one real quick. Another misconception, a lot of people, and I don't know if it's technically a misconception, but they're just like, well, that's how my family was. Like, that's just how I am. And it's like, no, that's actually a mental health disorder that you're dealing with. But they see it because so many people in the family may present this way, but they've never addressed their mental health. That's just how my family is, when it's, no, these are untreated mental health things. So yeah, that's just one misconception. Or even the last question was why some people might not want to get or address their mental health is because they don't even see it as mental health. They see it as, this is just who I am.
Or also that they don't feel like they'll get any better. And where I work at, we have peer supports, who is individuals that have been diagnosed with a mental illness, and they have been able to overcome it, whether it's through therapy, medications, and they have been able to sustain it for at least 2 years or more. And we partner them with customers with the same diagnosis, so they can help them get through it the same way that they got through it. So teaching them the skills and things like that. But that's a big misconception that I hear from a lot of people, like, I'm never going to get better, it's in my brain and things like that. No, you can get better. You just have to take the correct steps to get better.
What, if anything, would either one of you like to share about your own mental health experience when it comes to therapy?
I'll share. I actually just started therapy a couple months ago. I want to say maybe about 6 months ago. I did try it one time in the past through my job. They, offer like HelpNet. You get like a couple sessions. But the therapist that I had, I feel like we didn't really align. And so I didn't continue to go. And when I went the first session, I cried the entire time. And I said, well, I don't really like all of that. Like, what's all of this? What's this? And so I was like, I literally told my friend, I said, I'm not going back. All I did was cry. And she was like, that's therapy. And so I only did, I think, about 2 sessions. And that was about 2 years ago. So then I just kind of, let it go. And then I decided to start doing it again and like taking it serious. So what I did was I tried to find a therapist that wasn't in my area, so that way they wouldn't, because me being that I'm in the school system, I work in the community mental health center, I don't need that connection piece when it comes to my own treatment or mental health or whatever the case is. So I thought it was necessary to outsource. So I looked in like Grand Rapids and Lansing and stuff, but I found one. If anybody doesn't know, you can go on Psychology Today and you filter it just like you would anything else, what you're looking for, the different things that you're looking for. So that's what I did. And I found a great therapist, and I really, really, really love going to therapy. Knowing that, or being that I've always been in the mental health profession, I've always told people to go to therapy and recommended therapy and things, but I had never done it myself. And I also used to have while recommending people to go to therapy. I used to have the mindset of, what's the point of talking about my problems if the person I'm talking to directly cannot fix the problem? Why would I tell, what was the point? But now I realized the power of release, like just getting it off your chest, just talking to somebody who's not biased, who doesn't know you, who's not going to judge you, who's not going to have an opinion. You don't have to worry about if they're going to go tell somebody else. I describe it as, this is my person, like, especially because I'm not in a relationship. I don't have kids. I don't have anybody to kind of unload on. This person is there for me to unload on. I can unload everything I want to on this person. And so for me, that's kind of what helps me. That's the best part about therapy for me, is just that release. No, I'm not expecting you to fix my problems. You're not going to fix me. You're not going to, and it might not even be problems, because we talk about positive stuff as well. But it's just like, this is my time for me to release what I want to release. I can take up this whole hour for me. It's all about me. So if you are a selfish person at all, it might be good for you, because the whole session is about you. Okay. So genuinely, that's what helps me. I look forward to just going. I go bi-weekly. I know you can go weekly, you can go monthly. Bi-weekly is good for me, and we just chat it up, and it is so freeing and refreshing. So that's my own personal experience with it.
So real quick, Denisha, before you go, because that Janice said, she said earlier that, I believe it's her husband and her brother. They have PTSD. They were both in the service, and they go to therapy monthly. Right. And I was telling her, I put in the chat that one, it's good that they did seek help for, any struggles that they were having, any concerns. Let me put it that way. Let me not say struggles, but any concerns that they were having, because a lot of times people don't want to go, right? Or they say, talk to your pastor. I've said this before. Talk to your pastor. Pray about it. You of little faith. You don't believe enough, right? And I've said this too. I am a Jesus lover. But you should still go to therapy.
I always think of it as God created therapists. He put that role in position for a reason. He knew that people were going to need, he sets people in places to help his people. In therapy, and therapists are one of those people. Just like he set a pastor in place to guide the people of the church. He set teachers in place to guide the children. He set, mental health professionals to help guide, mental health, and doctors, everything else. So that's how I think of it.
Yes. So before you go, Denisha, because I know you go next, I starred Miss Alice. So this is going back to what we talked about previously. She said she's guilty of saying some of the wrong things, like the weather being bipolar. Since it has been brought to her attention, she's going to be more mindful. So that's good. Okay, I'm sorry, Denisha. You can go ahead.
Well, I really didn't have much, because I have never actually went to therapy myself. I have done therapy with other individuals. And like Sierra said, it's really all about that person. If the session is not all about you, then that is not therapy. If the therapist is doing more of the talking, that means that they're seeking therapy themselves through you. They should not be doing most of the talking. They should hear everything that you have to say. And then at the end of the session, they should be able to summarize what you have talked about. You guys should be talking about different coping skills. In your next session, they should have been giving you coping skills to utilize. So when you come back, they can find out, if you had to utilize those skills and did they help. And if those particular set of skills that they provided you did not help, then they should give you more, because they shouldn't dump everything on you all at once to give you skills to assist you while you're out trying to cope with different life events, because that'll be overwhelming. But if they're not helping you help yourself, then that's not therapy. So there are several times where I had to tell individuals who wanted to come to me, because my caseload got very overwhelming, because I was one of those persons that will sit there and I'm listening to you and I'm letting you release all of your negative energy, and I'm pulling it in and releasing my positive energy on you. So that can be very, draining some days. I'm not going to lie. Therapists also need therapists because of that situation. That secondary trauma sometimes is real. And so if, like I said, if that session is not about you, then you need to seek a different therapist, because you will not be helped. You're going to help them.
That's real good, Denisha, right? Because a therapist might. So let me ask this, Sierra. Have you ever had a therapist that he or she was dumping more on you or talking about their, issues, or that same thing happened to me?
No, I've never experienced it, but that is why I got into therapy, is because I experienced the dumping in both of I have two jobs. So I work in the school system as a behavior interventionist, and also in the community mental health setting as well. So I feel like I'm being dumped on all the time. So that's why I went and got a therapist, because I'm like, I need to dump some of this off of me. So no, I've never experienced it. But on the flip side, I have been dumped on, and it does get very heavy, and it gets very I'm like, I need somebody to talk. I need to release this. Like I need somebody to talk to too. So that's my experience with it.
Yeah. So I've never, or let me say Janice said she's guilty of that. She personally haven't set up a therapist yet, but believes that she can benefit from going to see somebody. So I'm gonna have both you. Well, I'm more Sierra, because you're in therapy. Can you tell us some of the benefits that you've gotten from therapy, and maybe this can help Janice see that the importance of it and what she can get out of it.
Honestly, for me, like I said, I didn't necessarily have, so I feel like my experience with therapy is a little different, because I'm not necessarily working through traumas and things. It's really just a place for me to release, kind of like things that go on at work, things that go on in my life. So for me, that's honestly the biggest benefit. Is it's like a weight off of my chest. It just, like, when we end the session, I feel freer, I feel lighter, I feel understood, I feel like, I don't know, that's just kind of the overall theme for me. And I do like that she gives me things to think about in a different perspective. So like she'll give me, we do a lot of like journal prompts and things like that. So when I journal, I kind of get to understand why I'm thinking the way I'm thinking, or what kind of led to that. And so for me, it's just very informative about myself. I'm learning about me and who I really am, and why I really am the way I am, and why I respond to things the way I respond. So for me personally, I think it helps you learn yourself better. You have that release of emotions and feelings. You're able to learn, like Denisha said, coping skills and things to actively try to combat whatever is going on. Say, like I said, if it's anger or whatever the case is, they will give you those actual tools and steps. Try this. Okay, that didn't work. Let's try this. And it's somebody there that is walking alongside with you. They're not just throwing you out there like, oh, that didn't work. Oh, well, I don't know what to tell you. Like it's a a team, like you're on a team with this person. This person is a team for your mental health. They're there to help you with your mental health and your just overall well-being. So for me, I just see it as truly the benefits for me is the release, and then the self-reflection or the self knowledge. I don't know, getting to know myself better. And when you know yourself better, you can kind of prevent things from happening. Like I know we're like right now we're talking about like why I react to things. I would just put it out there. I will go off, right? It doesn't take much to irritate me and make me, annoyed. And now I'm saying like, I'm not mean, but I definitely, I can be very vocal. And so I know that sometimes you just need to be quiet. You don't always have to. I'm always the type of person, if something's on my mind or on my chest, I got to get it off. And that's not always right. Sometimes you just need to be quiet, sit with God. It might not even be that serious. God might not even want me to say nothing. And so I'm learning why I react to things the way I react to them, how I cannot react that way. And so then as I continue with this, now I recognize those situations before I react that way rather than afterwards in a reflection, if that makes sense. So now I can see like, okay, this is one of those situations where you probably should be quiet. But because I know that about myself now, with talking through therapy and you saying stuff out loud, because then you can talk yourself, right in your mind all you want to. Yeah, right, you right, yep, you justify, you did that. But when your therapist is like, now let me give you another perspective. And it's like, oh wait, I didn't even think about it. I was wrong. I went off on her for no reason. Just things like that. So for me, like I said, it really the self-reflection and the release is it does it for me for sure.
So let me tell y'all, I am a witness. Sierra does go off. She does go off. It doesn't take much. I'll put it this way. It doesn't take much for her to go, to tell people what she's thinking and what's on her mind.
That is it. I like the way you put that, to tell people what I'm thinking, because that's what it is. I literally just speak my mind, but sometimes you don't just be
right.
Just be quiet. Is this productive or is this going to make you feel better?
Right.
That's what I'm learning.
So, Denise, I'm going to have you answer that question as well, because I want to be able to help Janice and anyone else as much as possible to say, one, there's no shame in going to seek help, right? To find someone, to find that support. Shay, just said that she needs to find a therapist as well. So, Shay, yes. And if Sierra mentioned it earlier, if you find a therapist and that therapist isn't working out for you, hey, let her go, let him or her go and find another one, right? You can go through as many therapists as you need till you find the one that's going to help and support you in the things that you need help and support in. So, all right. Go ahead, Denisha.
So there is no shame in going to therapy. However, it was a question in the comments that kind of steered me away from actually hearing what Sierra was talking about. So I didn't kind of catch that question, because I do want to I think it's ATO said she's saying I'm having to hold in a lot of grief so my daughter doesn't spaz out because she would be heartbroken. So that kind of took my attention away, because I'm like, well, suppressing it is going to delay her healing process. So she has to find some other healthier ways to do that, because it's not going to do nothing but bottle up her emotions and build up pressure, where then she's going to become very angry, her anxiety, she's going to become irritable, almost like feeling overstimulated. So even if she's not talking to a therapist or somebody yet, just taking a walk, talking, crying to yourself, journaling, finding some healthy outlet until she can get connected will be the better choice than holding it in, because it's not going to benefit her daughter if she has a breakdown. So that kind of caught me. So sorry, I kind of steered off over there like, oh, I don't want her to have to hold it in, and let her know that it's okay, that holding your grief in is going to be detrimental to your daughter than letting it out. So sorry about that.
No, that's good. Thank you. I'm glad you were able to see, her comment, and because I missed it.
Yeah.
And I wouldn't want her to think that we were ignoring it. So if I do not see your comment, please feel free to put it in the chat again, because we want to be able to, speak to whatever situation that you throw in the chat. So, Senna said the worst is when a therapist moves. It's like a breakup. Yes. So when you find a good one, I can imagine it being hard.
That's probably how I would feel when me and my therapist depart. I feel like I found the jackpot. I'm like, and it's like I said, I did the two sessions through my job, but this is my first time actually like seeking therapy. And I'm like, so I technically count her as my first therapist. But I'm like, I found somebody perfect, which that does not always happen. But it definitely, I was like, you could feel when it's the perfect fit. And if you, like we talked about earlier, if it's not a perfect fit, do not continue to go, because like you said, this is for you. And if you're not getting anything out of it, don't keep going just to say you're going. Find you a different therapist, a different treatment plan, whatever the case is, whatever you need to do, so that way you can get the best mental health treatment. And then I also wanted to mention real quick, I don't know if how this kind of fits, but I try to, being in therapy as well as being in the mental health professional, whatever, I just try to talk about therapy generally. Like, I don't hide the fact that I'm in therapy. So if somebody asks me, like when we talking, I'm like, yeah, and then I have therapy later. And then it's a casual conversation. It's not a taboo thing. I'm not hiding it. I'm not ashamed to say I'm in therapy, just the same as I was saying, I have a doctor's appointment, or I'm going to Meijer later, or I'm going shopping later. I say, yep, I have therapy this morning, like I normalize, or like, oh yeah, I talked about that in therapy, or I was just talking about that in therapy. Like, I say those things so that way it's normalized. So then somebody's like, oh, you go to therapy? Yeah, I go to therapy. And then we can start that conversation that way, instead of just hiding it or acting like, that's just private and I can't, that's secret and that's just for me, which it is, what we talk about in therapy is, but the fact that I go to therapy is not private or a secret.
I think we should make it a normal, it should be, the same as I have a dentist appointment today, right? Someone put in here, they think everyone, I believe it was Shay, she thinks everyone should go to a therapist, right? And like you, Sierra, you don't have to be having an issue, right? It can be, use it as self-care. This is my self-care, right? I'm just going to go and talk about the day, talk about, what's going on.
Or sometimes there might be fun, big, exciting things that are happening in your life that you just don't know how to process. So it doesn't always have to be, like we said, a negative thing. It could be, I'm getting married. My whole life is about to change. I need somebody to talk to. Or I'm about to have a baby. I've never been a mom. I need somebody to talk to. Or, I got this new job. I'm about to move states. I've never left my state. I need somebody to talk to. Like, it could be anything. It does not have to be, like I said, it doesn't have to be trauma or, just these big, I feel like everybody thinks of these big, heavy things before they go to therapy. And it's like, it doesn't have to be that. It could be, you just need somebody to, talk to or help you walk through whatever season of life you're currently in.
Right. Mm-hmm. So, Crystal, I just dropped the link. You are more than welcome to join us. Crystal says she got something to say. Yes, I just dropped the link. If anybody would like to come up and join us, you're more than welcome. Okay, so she's going to join us in about 4 minutes. So what part does, we mentioned it earlier, but what part does spirituality play in your mental health, or play in your mental health, but also in you going to therapy?
For me, it goes hand in hand. I feel like, especially with right now, the church that we go to, we are doing classes, and I am a teacher in one of the classes, and it's toxic. I'm teaching the class about toxic thinking and getting out of your head. And so that's something that I'm also talking about in therapy, is toxic thinking and why I think the way I think and why I act, that toxic thinking becomes toxic patterns and things like that. So for me, they really go hand in hand. And like I said earlier, I really believe that, God puts people in places to help his people. We know that God has a purpose for everybody. And, he gave me the purpose of working in the mental health field, as same as others and therapists. So they're there for a reason, and it's no shame. Like we said, you don't have to pick one or the other. Well, am I going to be a Christian, or I'm going to address my mental health? You can do both. God wants you to do both, because if you don't address that mental health, I doubt how God-like or Christ-like you're actually being, if you're not. I don't know where I'm going with that, but yes, you can do both. And for me, like I said, they really go hand in hand. I use them together. And that's one thing I did look for when finding a therapist. I looked for a Christian therapist, because I know that is a huge part of my life, and that is something that I'm going to want to talk about, and that is a big reason of the a big part of the decisions I make, and why I act the way I act, and why my goals are what my goals are, and things like that, is because it's coming from those biblical principles. So I need somebody who understood that. So my therapist is a Christian, and I made sure of that.
Mm-hmm.
That's good, Sierra, because you definitely have to be careful when you bringing in religion when it comes to therapy as well, because our population is so diverse and we got different cultures and religions. So sometimes even at work, I have to catch myself when I am talking about godly things, and it comes out. But for me, like I said, I haven't done therapy myself, but for my spirituality, it just gives me a deeper meaning. And I do use all those classes that we have taken for coping skills, because like I say, sometimes your faith can be tested. I'm saying, like, I don't care how spiritual you are, your faith will be tested. And sometimes it'll make you want to steer away, but then you got to get back into the word, start praying and things like that to help you heal. So that's those classes at church, they have been so beneficial.
Mm-hmm. So I'm going to bring up Phoenix Rising.
Hello. First, I want to say thank you so much for the amazing comments that you put on the song that I had written for the book anthology that I'm doing.
Yeah.
Thank you so much for all of your amazing support. It's really appreciated. That book actually comes out July 1st.
Oh. Okay. Put the name in when you go back down, put the name in the chat.
Well, I'll do better. I'll tag your channel when we do the book launch on the 1st.
Okay.
For those of you that don't know, okay. Is it okay if I just give my little introduction, because you're the only one that's like kind of met me?
Right.
Right. Okay. So my name on YouTube is Crystal Phoenix Rising. It's my channel. I go by Crystal Phoenix. I'm a author, speaker, advocate of both not only just mental health, but specifically domestic abuse recovery. As a survivor myself, I took my pain and turned it into a purpose. This will be book number 9 that I will either have written in or published. I do a lot of mental health anthologies. For those that don't know, an anthology is a book written by many authors under a general topic. Okay, think Chicken Soup for the Soul books. Okay, and the one that I have coming out on July 1st is called "We Choose Not to Be Our Diagnosis." It's think I have bipolar, not I am bipolar. I have cerebral palsy, not our diagnoses don't define us just because we have our neurospicy or have a physical disability. That's not who you are. It's just part of you.
Right.
So
that's why you want to always use person first language.
Yeah. I am actually a certified art therapist and life coach, and who's trauma trained. And I take everything very personally. I have done all kinds of therapy. EMDR is a real big one that I'm a big firm believer in, but it's also very hard. It's not for everybody. But for those of us that have CPTSD, it really does help a lot in retrain the trauma responses in your mind and stuff.
Right. So,
yeah.
Crystal, I need to have you back up to do a topic on trauma, right? And domestic violence. Journey Muir, which is blue, she said, like, she's a survivor, right, of domestic violence. So that's a topic that
I'm always willing to dual stream talking about those topics. In fact, I had gotten a normal job at Menards, so I had to kind of base off what I had started, but I'm doing a series on trauma bonds, on the different forms, how to overcome them, how to recognize them. And because trauma bonds are not just romantic relationships, you can have them in the workplace, you can have them, there's so many different forms.
Right.
And I've done a few of the episodes. I just haven't been able to do it much more because I've been working like 10 days straight, a day off and going forward. And, on my day off, occasionally I like to, have a day off and not do this stuff as well. Because, self-care is important.
Yes. So, Crystal, we'll definitely, because today we are talking about mental health and mental health therapy, but I would definitely want to have you on one of our Wellness Wednesdays to talk about trauma.
Absolutely. Like I said, I'm always down to, dual stream and stream because these are all topics that need to be talked about.
Right. Brandy,
I've been growing my channel for about 1.5 years. I'm 14 away and partial. And the only reason in the last weekend I've jumped like I have is because of you and Red. And, you guys all just like boosted me 16 new subs. I'm at 486 subs.
Nice. Yeah, I really like your channel. Brandy, what do you think? We should have her on and do.
Yes, absolutely. I second that.
So, but I saw what the topic was, and when it comes to spirituality, I'm spiritual, not religious. I will put that out there.
Tell me what that means.
Religion in any way. I don't follow secular religion. I'm spiritual. I talk to God at home. I don't go to church. Okay. I respect everybody's choices, but I do my worship at home.
Okay.
Yeah. Everybody has the right to have their hope and their religion and their faith, in their own way. And I'm all for that. Whatever gives you that peace and helps you, you know? So, and yeah, spirituality does help with your therapy and things, because if you have that belief, you're not questioning everything, you know? When you lay what's going on down God's feet and have them help, it helps lift you up, you know, your faith. It gives you hope.
Right.
So,
Um, Blue said, she says it all the time. Being spiritual, not and religious is not the same thing. It means something totally different.
yeah.
So,
Mhm.
all right. So, wait, Denisha. I'm sorry, Crystal, because now I can't remember what question I left off on. Because I was going to have you answer a question.
So you asked the last question was how does spirituality
Play into
yeah.
into therapy for you.
For me,
No,
honestly,
I'm sorry, Crystal.
Mhm.
For Denisha.
Okay.
Yeah, I answered that before Crystal came on.
Yeah.
I can,
Okay. Okay. So, Crystal, how does it play for you?
For me, going outside and being in the elements and letting just the different energies from the earth and from God and everything just envelop me and calm me, it does matter. It I'm very, very holistic with my therapy, with my approaches with my own clients and everything. I'm very big with like meditation and just calming, you know.
Mm-hmm.
So
Brandy, you got any comments?
What was the question? I'm just kind of catching up.
Okay.
Technical difficulties, so I'm trying to jump back into where you all were at.
Yes. So, Crystal, can you put your mic on mute?
Sorry about that. I just got home. I'm just trying to unwind. It's been a hot day.
Yes. No problem.
Yes, it has been. So you said, how
So,
does
yes.
spirituality, how does it work in conjunction with therapy?
Yes. And then I have another question after that. But yes, how do
Okay.
you think the two relate?
For me, well, first, let me add that I've been in therapy since this past September. It's been very helpful. And, you know, like Sierra said, that's my time, that's me time.
Mm-hmm.
So I literally, a lot of times, I'll leave the house, I'll go sit in the car, talk with my therapist. We talk about what we're going to talk about. And it's just like, okay, I got that off my chest. But when she kind of points things out or reflects back to me, like, I hear you saying this, but it's actually this, or this is what I want you to work on, yada yada yada. There are some times where I'm like, I don't know if I can receive that, and not because I'm unwilling. It's just a lot of times it's a shock, you know. Case in point, last week, um, she told me that, she said, that sounds like you are always staying ready so you don't have to get ready. And I was like, I've said that more times than not. And she was like, but yeah, that's a lot of anxiety. And I was like, oh, okay. Now, mind you, I'm well aware that I have anxiety, but she really put it into perspective of just how much of the anxiety that I have. And, you know, it's kind of a little bit broader than what I thought. And then having those moments of kind of realizing these things about yourself, like I said, some you don't really want to willingly accept it, because I'm thinking that's how I've always operated, is stay ready so I don't have to get ready. So now I kind of have to go and break down a lot of things when it comes to how I operate and how I interact with people and how I deal with things. So when I think about that, it's kind of like, ooh, that's a lot. How am I going to get through that? I got to turn to God. I've got to have faith. I've got to stay in the scripture. I have to find those scriptures and find those words in the Bible that are going to give me the strength, give me the comfort to be able to realize that, okay, this is going to be a one day at a time. And also realizing that as I start to shift that stuff, there might be some people that, fall by the wayside because now I'm going to be changing. So their response may not be the same as it used to be. So I say all that to say that it plays a big part. And I think another thing that I want to add is that I feel like it's important to go, if you are trying to work through trauma, you have to be willing to do the work. You have to be willing to do the work, because if you're not willing, you're wasting your time and you're wasting that therapist's time. They may not care because they still get paid, whether it be straight out your pocket or through the insurance company. But I just wanted to add that 2 cents that if you go, just do yourself the favor and be open as you possibly can about, trying things in a different way and kind of turning that mirror on yourself.
Right. Okay. So, how does what self-care practices do you have in place? Or do you think you need to put in place?
So I would say for me, I love to work out. So working out is a very big part of my self-care. Listening to my music, and it's, gospel most of the time, in my car by myself, taking long rides. But then self-care that I have to practice at work in the mental health field is I have to have boundaries. I can be empathetic. However, I got to learn to leave my work at home so that I don't displace negative energy into my own family because of some of that secondary trauma. So really, I have to have self-care. For me also is having boundaries and things like that. So.
My self-care is the same, kind of. I like taking walks. I like doing things like getting my nails done. I'm very big on like solo dates. Just journaling, just anything that really pours back into me, and really just being able to sit with myself and reflect with myself with no outside noises and things, or just doing things that genuinely make me happy. And like Denisha said, just really creating those boundaries and leaving work at work. And when I come home, just focusing on me and my life, and knowing that I'm not here to single-handedly change anybody's life. That's not my responsibility. And so knowing that helps. It's obviously easier said than done. But yeah, so just leaving the work at work and really pouring into myself when I'm home.
So, Jackie McKeever, my real sister, she asked, what kind of therapy would you look for if you get frustrated a lot?
So I would say,
or are they all the same?
They are all definitely not the same. There are so many different therapies that you have to look for. But if you get frustrated a lot, you probably want to look at CBT, which is cognitive behavioral therapy. You might want mindfulness. And the acronym is MBSR. So it's mindfulness based stress reduction. It could be some trauma. So you got to find the underlying issue. So you might need trauma therapy, or you may need solution focused brief therapy. So it really just depends on what is the underlying issue that's causing your frustration. And so sometimes you might have to seek a therapist to talk about that first, have that first session, and that therapist should let you know by your first session talking to you if they're able to assist you in the type of therapy that you need, or they should be referring you to a therapist that can.
Mm-hmm. And then, Sierra, you have anything different?
No, I would just kind of piggyback off that. They're not all the same, but definitely go to that session and allow your therapist and you to kind of figure out what's best for you and what you need through there. Yeah, that's what I would say. Just really lean on them, and really, if they refer you, if they tell you, hey, this is not really the therapy that, you should be in, here's what I think you should do, I'm going to refer you to this person, you should probably, listen. That's just what I would say. Like, don't be like, well, no, I know I have. Well, the professional is telling you, this isn't the one for you. Just because your cousin did this kind of therapy doesn't mean that one might be, for you. So that's just what I would say. Just piggybacking off of what Denisha already said.
Yes. And then, Jackie, maybe look to see if where you live has a community mental health. I'm trying to think. I can't think right offhand where or who, but maybe contact, I don't know, maybe DHS, and they can tell you where the community mental health is and see if you could go and talk to someone.
I know a lot of times when some of my customers are moving to different states or cities, you can really Google where the CMHs is at, and then some places have 4 or 5 if they're large. And then if you put your address in, just say the closest to this, then it'll pinpoint you to that. And then you can call for a phone intake to even see if that's something that you need, or if that's the CMH that's really located next to you. So that's what I do pretty much all the time when you call in, or, I'm not sure if all places have 211 for those resources, but I know sometimes DHS is not always helpful. So that's why I just threw that out there, because Google really does help. Not to diagnose yourself, but to find different resources.
Yes. So, Sierra, I don't know if you can hear me. I just wanted to basically applauded you on the solo dates.
Thank you. Those are my signature. I take one almost at least twice a week.
Yeah.
It can be as simple as just going to eat. You got to eat, right? Go take yourself out to eat, and just, I love it. I love it.
So you want to talk about your solo vacations?
Yes, I actually leave in 2 days. So last year I took my first solo trip. I always see people, talk about taking a solo trip, and I started doing the solo dates, and I'm like, okay, a solo trip? Now, I don't know about that. Am I going to be bored? Am I going to be safe? What? So I ended up going to Myrtle Beach last year, for my first solo trip, and I loved it. I fell in love with it. I'm like, do I want to travel with people ever again? But I just love being able to be on my own accord. And but I'm a very chill type of person. I like to chill. I'm not a turn up person all the time. So my solo vacations are geared towards relaxing, which this time I thought I was going to be going to the beach again. I'm going to Charlotte, and I thought I was going to be going to the beach, but there are no beaches in Charlotte. So I have found some dance. I have a Christian dance class that I'm going to go to. I found like a line dancing class, just some different things. There's an R&B bingo night. So I'm just going to go and just do fun things by myself, meet some new people, and just really just enjoy my own company. So I'm so excited. I love doing them. So I said I'm going to do one every year. And we'll just try different places. I'm not a winter girly, so you're not gonna catch me taking no solo trip to Colorado and all that. That's not a vacation to me. So I'm gonna stay I do eventually want to like go on a resort out of the country, but going out of the country by yourself, I don't know about that one.
No, you need to take your parents with you.
Y'all gonna have to stay at a totally different resort.
Just staying on the same topic for a minute, or with Sierra. So Blue said, Sierra girl, you are glowing. Give us some of that glow. She says she's going to sub to you and she's going to share you out.
Thank you so much. Thank you.
Yes, and Blue has a lot of followers.
Huh?
I said Blue has a lot of followers.
Ooh, yes. Thank you, though. Thank you for that.
Here's a little plug, and then we'll get back to this. Do you remember? Oh, I don't know if Sierra or Denisha, if you were at church the night we had. We talked about. Pastor did spiritual health for us, and Brandy did a piece on journaling, and people were able to win journals. Blue's the author of the journals that people were able to win. So, Sierra, I'll share it with you because Denisha, do you like the journal? I know Sierra likes the journal. I'll share it with you and show you. It may be something you're interested in.
Yep, I do journal, so yes.
Okay, I'll share it with you. So, yes, Blue. She should take me and Mister on vacation.
Y'all pay, we can go.
Oh, okay, never mind. Going back to what Blue said, she said, we need more CMHs. They're so far and few between.
Yeah, we only have one CMH in Calhoun County, so I do agree with that. I don't know where you're located, but we definitely need more CMHs in the areas.
Mm-hmm. Mm-hmm. Brent, do you have anything you want to add?
No,
Because we're going to be wrapping up here soon.
No, I appreciate everyone in the comments. I appreciate Sierra and Denisha for your insight.
Yes, thank you, ladies.
This was a good conversation. I appreciate you guys having us on here.
Yes. Do you have anything you want to promote? Anything you want to share? Anything coming up?
Go ahead, Sierra. I didn't know if you was.
I was gonna say my YouTube. I think you have it linked or something.
I will link it, but go ahead and you can share what it's about. And
yeah, so I am starting YouTube. I'm on TikTok right now. If you want to follow me.
And how many followers you got on TikTok?
I have 31,000. Yes. So I've been doing that for about a year. So if you want to follow me on TikTok, that's CMills1. And then YouTube, I'm just starting out. That is CMills05. And yeah, it's just like a lifestyle page. They're going to be vlogs. I'm going to incorporate some mental health stuff because I work in the school system. I like to talk about some of the resources and things that I use in the school system for like emotional regulation and things. I do skits and just like skincare and beauty stuff. So just, yeah, all kind of different things. We definitely talk about God over there. I just share my life kind of and, vlog it as I go through it. And it's fun to look back on and I enjoy it. So if you feel led to, please like and subscribe.
All right.
Mm.
Miss Denise, and then I will share her link again. And if you can all go over and subscribe to her channel, we'd appreciate it.
And then, so myself and Lakita will be starting us a podcast. It will be called The Naked Mind. It's the real talk on mental health. And so we will be doing weekly sessions on that, and it will be live and things like that as well. We'll have different special guests on there as well. So yeah.
Okay, so Denisha, have you all started the link? Do you have a link yet?
I don't have the link yet, so I'll provide that to you. So then the next time you can provide it to your followers and subscribers. And
so then maybe you and Lakita can come back.
Come back. That'd be a good launch.
Okay.
Yeah. And we can do, share you out so you can get, people to subscribe to your channel, because mental health is a huge topic.
Yes.
Right? It's a needed topic. We need to have more conversations.
Yeah, because we're going to definitely get raw into it. We're going to talk about, the individual that was talking about families need to be educated more. We're going to talk about that a lot on there. So we're just going to talk about a lot of different things, like the real, raw, and uncut things about mental health. So
yes,
I love that.
Yes, I love it.
Yes.
So talk to Lakita and ask her to, I'll have Randy and I will have both of you back on so you can talk more about it, and we can drop your link.
I will definitely do that. And then one thing that I'll leave with, because this is just super important, is to be kind to your mind and to the minds of the ones you love.
Yes. So ATL said, let me put her comment. ATL said, I would like them to be here telling my daughter's story.
Okay.
So ATL, are you saying you would want to come back on panel when they're up? Brenda, do you understand the comment?
I think that's what she's saying.
Okay.
Yeah.
Yes. We
So
can
when they come back, yeah.
Yes, we can have you come up, and Denisha will be somewhat familiar with a small portion of your story, and she'll be able to comment on it. So I'm going to drop the link one more time because we're going to get off here by 8:30. If anybody have any comments that they want to share and come up and join us, you're more than welcome. You're more than welcome, because we're going to get ready to end soon, but we would love to hear from you. So I have a question up here. What will you intentionally do after this conversation? So my pastor, our pastor, Pastor John, who was on last week, if you all remember, him and Deacon Sam were up here last week. And Sierra, y'all can tell me if I'm quoting this wrong, but knowledge without application is extra weight, right? So if you could just put in a chat what you're going to intentionally do after this conversation. I know Alice had posted earlier that she's going to be more mindful of the language that she uses. Will anybody else do anything differently? I know Shay left, she had to go, but she's seriously thinking about, she said she's been procrastinating. She's not embarrassed, right? She's not ashamed of going to therapy, she's just procrastinating. So I'm gonna try to push her to make that appointment.
And then also remember too that if you're not comfortable going in office, a lot of people is still offering telehealth where you can sit in the comfort of your own home.
Mm-hmm.
You're comfortable with going into the office face to face.
Yes. Because I think, Brenda, your sessions are online, right?
Yeah, mine are virtual. Mm-hmm.
Sierra, are yours virtual? Yeah, so you don't have to go face to face. So I think what I would do after this conversation really is just to engage in more self-care, right? I do not at this time have a reason to go to therapy, but if I needed to go, oh, I'm going, right? Blue said, I'm going to intentionally be more intentional about, okay, solo dating and self-care. Wait a minute. What the kids do or the young people? Yes, Blue.
You got to clock that T.
Oh, that's what that means? Clock the T?
Just one. Just
Oh,
one.
just one. Yes, Blue. Yes.
Put
yes.
the fingers up. Never mind.
Solo date and self-care. I be using this every chance I get, and sometimes they don't even go with the situation. And then I be like this.
Wanda.
I be trying to be hip. I gotta, Sarah, y'all, I gotta stay up. Alice laughing at me. All right. Anything else? So, Denisha, you're coming back. You and Lakita, talk to Lakita. Yes, we would love to have you, right? And the whole live, we can talk about what your channel is going to be about and the importance of just being raw. So, want to stop doing stuff.
We would love to come back.
Sierra, so Blue said, Wanda, stop doing stuff before you know what it means. Sierra, get her, please.
I try. It's hard raising your parents.
ATL Shaw said she wished she could date.
Me too.
So, yeah.
I'm married. Date yourselves. No.
No, you don't. Trust
Yeah.
me.
So Blue is married, and she's still talking about going on some solo dates.
And that's something I
Spending
said.
some time with herself.
Yep, that's something I said when I do become a wife and a mom, that I still want to go on my solo dates. I still want to take a solo trip. Now, it might not be flying somewhere. If it has to be a solo staycation, it'll be a solo staycation. But Sierra is going to stay Sierra when she becomes a wife and a mom.
Mm-hmm. Yeah.
Okay, Sierra. You just said and done, but
He said, sounds good.
because I've tried to do it, and
Sounds
somebody
good.
shows up all the time.
Hey, my husband,
It's nice because somebody he can pay for it, and he paid for everybody else too. So come on.
so funny.
Janice said she needs to remove triggers in her life. So
That's a big one. That is definitely a big one. You have to remove triggers, and it's just small things can trigger you. So it's really the might be some people that you love that you have to remove yourself from. Not saying that you no longer have to love them, but you can't always be around them and things like that. Is just like the little small things. Even if this is not like far as mental health, but like I deal with a lot of people with substance use. Like you can't always, like if you used to smoke and drink at the same time, you might have to cut out. If you want to cut out drinking, you got to cut out smoking. Like you got to cut out several things in order to avoid and remove those triggers in your life. That's a huge one. And people don't always see that. Sometimes you have to remove yourself from toxic jobs and things like that to remove triggers. There's, depending on what triggers that's in your life, there's going to have to be multiple things that you're going to have to remove even the one trigger.
And I also want to say, triggers are our responsibility. If you know your triggers, it's not okay. Not saying this is your situation, I'm just talking in general, but it's not okay to continue to put yourself in situations to be triggered and then say, well, that was my trigger, use it as an excuse. Like, say, I don't have an example, but if you know that somebody, being rude to you or cutting you off is a trigger, and you know that every time you speak to this person, they cut you off, it's not okay to just continue to go off on them and cuss them out, because you got to kind of avoid those triggers. Like you said, when you know what the triggers are, it's different when you don't know what a trigger is and you kind of run into it and you're like, oh, that kind of triggered me. But if you know for a fact this certain thing triggers me, it is your responsibility to kind of, create those boundaries. You can't just say, well, don't trigger me. Okay, well, you know what your triggers are, so you have to create those boundaries.
Mm-hmm.
Yeah, and I really think that therapy can help with learning your triggers, because they will get down to the underlying issue. Like they should be asking you what led up, what happened the day before or hour before, or whatever that led you to feeling the feelings that you had currently. So that's a big thing that therapists should be helping you with, is learning your triggers if you don't know them. Some you may know, some you may not know. So that's huge. In your healing process, that's going to be huge.
Mm-hmm. Yes. So Blue said, and knowing the triggers to be able to remove is a plus, right? Almost like what you and Sierra was just saying, right? You don't have to, if you know that you're triggered around certain people or around certain situations, you don't have to be around that, right? ATL Shawty said, I have to figure out how I can have people around me.
So
Go ahead, Denisha.
I was going to say, so sometimes, the current circle that you may have may not be your people. Sometimes we find our people in different areas. Like at first, like I wasn't going into the body of the church, and I'm not telling you have to, because I don't know what religion or spirituality you find, and I don't want to push that on you. However, though, you might find your people in a different setting, so you have to make yourself more available in different settings, whether it's church, whether going to different groups, whether than reaching out to the National Autism Awareness and trying to connect with individuals like you. It may not be the same people that you're used to. That's where you're going to find your people when it comes to somebody to help you and not run away because your daughter is suffering from a mental health issue.
Mm-hmm. That's good. Thank you, Denisha. Sierra Blue said, what you were saying is true, because other people don't know what our triggers are, right? And if we do, we have to take the responsibility of removing ourselves.
Or if you want to be in a relationship with this person, communicating those with them. It's not okay to just go off or react to that trigger and then blame, them. Maybe if you want to have that relationship and they seem to, want to understand, then you may have to explain those triggers to the people that you love, so that way they can also be mindful of how they interact.
Right. So Janice said, like, she can't stand to be around negativity and judgment, right? A lot of judgmental people. She said, no drinking or smoking here, but it's just being around negativity, right? And that goes with setting boundaries, No, yeah. So, Brandy. Oh, so ATL said, "Mine are my her family, and it's hard not to be around family."
Her YouTube family, maybe. I think.
Oh,
That's
maybe
what I'm
that's her
taking
people.
it. Her
Okay, I'm glad
YouTube.
y'all clarified that because I was saying she
Mhm.
didn't want to be around her family was her trigger. But okay,
Mhm.
so her YouTube family is her community. Hmm.
I think that's great that she has that. And I think it's important that as a mother that you, if possible, find the time for yourself. Try a solo date that Sierra's been talking about. Or if you know another parent who, has a child that has, similar situation as to what your daughter does, even though, she doesn't want to be around people, I think caregivers taking self-care is extremely important too, because
Hmm.
you have to be whole and at the best that you can possibly be, to be able to be there for your daughter too.
Right, right.
And then just one last thing, because I know it's almost 8:30. It is 8:30, and you may also be able to find like other parents who, again, like I say, suffer from what you have. You guys come together and sometimes watch each other kids, so you can go on your own solo date and have you time, because that'll help, and you guys switch off one weekend or one day or whatever, so you guys can still get that come together sometimes, and then also be able to be that backbone for them, where then you'll allow them to go out. So just finding people in the circle that you might have to make yourself. You might have to be the one to create that, because I'm sure there's other people that's feeling the same way you feel.
Hmm. So, Blue said communication is key. She's learning that is more important than ever in relationships. Um, Alice said she don't like being around negativity either. Right? She tried to avoid it at all costs. Um, Blue said she's still learning. And then lastly, ATL said she loves her YouTube family. Really, all she has. I don't have people that can sit with her, but it's always it's always me doing for others. So Blue said true negativity and trying to avoid it is key. Trying. Sometimes it's hard. It's hard. It's hard. Right? And that's on YouTube and in real life with the people you're around, that you see. So, yeah. You have to carve out that space, for yourself. You don't have to be around negative people. And then if they are around, just politely excuse yourself. Right? So, all right. Thank you. Thank you. It's 8:32, and I told y'all 8:30 or around 8:30-ish. I probably told Sierra, you know.
You
I'm
can't
like,
you can't use that there. That does not
oh.
even fit. Oh, Lord.
Oh.
You're so funny. I'm really not typing that fast.
Good night. Thank you, Jackie. Thank you,
Very
sister, for
slow.
joining us. Brandy is typing fast. Okay, I need a mic. I need the mic she has. Oh, you got a mic, Brandy?
I was just typing.
Yeah. Maybe they can hear you louder tonight. Brandy speaks.
Oh, you know what? My phone is right on my laptop, so you can hear me click clacking.
Yeah, okay. So thank you all for joining us. Please hit the thumbs up. Subscribe if you're not a subscriber. Share this live. And for those of you that are catching the replay, make sure you leave a comment, right? And you do the same. Like, share, and subscribe. Anything else? Am I leaving anything out?
I don't think so.
All right. So Janice said she enjoyed the live. You all have been so respectful and understanding. Blue said, okay, her computer mic was picking up a lot of what, yes.
Mm-hmm.
Yes. So please join us next Wednesday when the conversation will be about, we don't know yet.
Yeah, we don't know yet.
But
be here next Wednesday at
just
7.
be here next Wednesday because it'll be another good one. And we'll have more guests to talk about, again, either mental health, physical health, spiritual health, emotional health, well-being in general, because you deserve to be the healthiest and live the best life that you can live. Brandy, any last comments?
Oh, yes, no, that's the last comment. No, I appreciate everyone.
So yes, Janice, she works in HR. She calls your fingers the HR fingers.
Mm-hmm. That's why I was telling Journey, that wasn't fast at all. It just sounds fast, but no.
Yes. So everyone have a good night. Thank you so much. Sierra and Denisha, stay on for a second. Have a good night. And we thank you so very much for joining us. And we'll see you next Wednesday.
Have a good night, everyone.